So, what is a routine like as an ICU nurse? First thing you do, you come in and you get report on your two patients. Report is pretty detailed, including past medical history. They talk about the story, why they ended up here, and then we go through systems wise. So, neuro, respiratory, cardiac, GIGU, like what's going on with their systems, and then lines and labs and drips. After you get report, I like to look through my orders and see like what I really have to do, because sometimes, you can't always trust the nurse giving you a report. It's better just to see for yourself. And actually, what I've started doing is I've looked at my orders, see what I don't need, and I go up and introduce myself to the doctors, tell them what patients I have, and ask them to clean up a couple orders, because the last thing I want to do is like a Q1 hour neuro check on a patient who I know is ANO times three. They no longer require Q1 hour neuro checks. And then I miss them, and then, it looks bad on my part, like I am ignoring an order. We don't want that. So just clean up the orders right away. Then I go and introduce myself to the patient, do my first assessment, check all my lines, make sure they are where I was told they are, make sure they flush, see if they draw back, and just get a really good first assessment done. At my current hospital, the policy is to do a full head to toe assessment every 2 hours. So you're just really in that room all night. And I'm not sure if you've heard of the term clustering your cares, which is essentially just going into that room, like let's say we're going in at 8 o'clock, introducing ourselves. I'm going to do everything I need to do for 8 o'clock and 9 o'clock, and try to get things done for 10 o'clock, just to minimize the time spent in the room, to let the patient rest. And during those times you're not in the room, obviously, you're charting everything you just did. The next big time to cluster, I would say, would be 11 o'clock. At 2300, you're able to give your midnight medication, do your midnight assessment, and also get your midnight labs. So that is another big time to get things moving. And then after 12, I feel like things kind of chill out depending on what type of assignment you have. At around 2 or 3 o'clock, I like to do all of my baths. We do the bathing on nights. And then 4 and 5 o'clock is another big like chunk of time, like power hour. You can get a lot of things done. And I like to make sure I have everything charted by 6. That is the goal. All my labs are already sent, and I am redoing my report sheet for the next nurse. So that is what the routine is like as an ICU nurse.